39-year-old priming gravida woman at 7 weeks gestation comes to the ER for vaginal bleeding. Ooh, okay, so pregnant woman experiencing vaginal bleeding. This is dangerous, okay? Might be threatened abortion, okay? So let's continue reading. She has had dark brown vaginal spotting and mild uterine cramping for the past day. So this could be dangerous, all right? But he said spotting. Spotting is not as dangerous, okay? So spotting is not uncommon in early pregnancies. So women who have pregnancies, if they came complaining from vaginal bleeding, don't just tell them, oh, it's dangerous, it's threatened abortion. No, you have to keep in mind that pregnant females experience bleeding, small, very, very small amounts of bleeding sometimes here and then. So it's not really a big deal until you make some further investigation. So an ultrasound is definitely a requirement here because she's having some kind of, dangerous sign per se. Okay, so let's continue reading. The patient has felt extreme fatigue and has had daily nausea and vomiting for the past week. Normal, okay, she's pregnant, she's definitely gonna have some nausea and vomiting now and then. Blood pressure is normal, pulse is normal, the abdomen is soft without rebound or guarding, so there is no rupture there is nothing in the peritoneum. This sentence here, without rebound or guarding, there's nothing in the peritoneum, everything is fine. On pelvic examination, there is scant dark blood in the vagina and the cervix is visually closed. So in pelvic examination, there is scant dark blood in the vagina and the cervix is visually closed. Scant blood and there is a pelvic ultrasound. Okay, nice. All right, so as you guys see here, which of the following is the most likely diagnosis of this patient? Let's read. Embryonic gestation. Embryonic gestation, I'm going to show you guys the picture of the ultrasound here. It means that there is no embryo at all. It's just a gestational sac. There is another definition for it, which is blunted ovum, but this is not the case here, okay? Complete hydatidiform mole, that's also not it. Complete hydatidiform mole has this snowstorm appearance on ultrasound, so this is also wrong. Incomplete spontaneous abortion, normal singleton, incomplete spontaneous abortion. Incomplete, so no, this is wrong too because the cervix is visually closed here. An incomplete abortion means some fetal conceptuous came out from the vagina. So, and you will see the cervix is open, it's not closed. But here it's visually closed, so it's not, definitely. D, normal singleton gestation with fibroid. Okay, yeah, so he's telling us that these two circles we're seeing here, one of them is a fibroid and the other is a fetus, okay? This is tricky. This could be the answer, but I'll tell you guys why this is not the answer. Because a fibroid is hypoechoic. So you're gonna see just dark circle as a fibroid. I'm gonna show you guys some pictures of the ultrasound fibroid here. Okay, so it's not gonna be like this. As you guys see here, this is two gestational sacs having two fetal poles in it, okay? So is it normal singleton with fibroid? No, D is wrong. Is it E, twin gestation? Yes, it's D. It's just as simple as that. It's twin gestation. So let's read the question again, okay? Because she came complaining of vaginal bleeding. So is it normal to have vaginal bleeding, dark spotting, vaginal spotting, and even mild uterine contractions in early as 7 weeks? Yes, it's normal. That's normal. That's absolutely normal. And because they are twins, it's even harder for the uterus to contain them, so there will be mild cramping. That's absolutely normal. And the nausea and vomiting are very high here because of the high beta HCG, because the beta HCG activates the vomiting center, it can cause nausea, all right? So the main complaints are being accounted for by the diagnosis. That's fine. Vaginal bleeding, yes, it's normal in twin pregnancy. Dark brown, yeah, this is how the vaginal bleeding is, and mild uterine contraction is the same thing. And of course, extreme fatigue and daily nausea and vomiting, we said that, okay? And yeah, we eliminated all answer choices. Okay, let's jump to the next question here. A physician goes to labor and delivery on Friday evening to check on the labor progression of her patient. The patient has had a protracted labor course throughout the day. Okay, so she started labor over the day, in the morning, let's say. Her cervical dilation has increased 1 centimeter over the past 3 hours, and she's now at 8 centimeter dilation. The patient's vital signs are normal, and fetal heart rate tracing is category 1. So category 1 is normal. The physician is leaving town for vacation in a few hours, but an on-call obstetrician will be available for deliveries. Okay, so that's fine. The physician recommends a cesarean delivery, C-section, to the patient because of the protracted labor course and the physician's inability to be at the delivery room in a few hours. Wow. Okay, this is weird. So he recommended a cesarean delivery to a patient who has the fetal heart rate tracing is category 1, and it has normal dilation here. It increased from 1 and became 8 centimeter. Everything is going smoothly, and yet he wants to perform a C-section. Okay, this is kind of an ethics question, so I believe there will be some kind of a mistake here, all right? Yeah, so this situation demonstrates which of the following, ethical principles, all right? So let's read. Beneficence. Beneficence means doing the best in the interest of the patient. Is he doing that? Is the doctor doing that? No, he is not. The normal, and the reason why is that there is an OB-GYN doctor here, okay? He's gonna be present, so he doesn't have to worry about his patient because she's gonna be having a doctor, right? He's on call. So he doesn't have a reason to be that scared because everything is going smoothly here. The labor is going fine. So beneficence, no, it's not in the best interest. I think he is doing in his best interest. So A is wrong. Conflict of interest, yeah, this is B, this is definitely it. He wants to go on a vacation and he has a patient who is in the OR or whatever, she's doing labor now. He wants to, I don't know, perform the C-section in order to get money. I don't know why he's doing that, but definitely he will also want to go on vacation. And guys, C-section is not an easy surgery. They open up the uterus and there will be scarring and a lot of stuff. So it's not the best option here, okay? She's doing fine. Why is he doing that? Come on. Directive counseling. Okay. Directive counseling is kind of an advice from a doctor, but it's very directive. So basically the patient has this problem of choice. He doesn't really understand what to choose from the two options. For example, let's say this guy or this woman has two options, C-section versus delivery. So the doctor gives her the two options, but he kind of directs her towards a choice of them, all right? Because it's for the better. But this is not what the doctor is doing here. The doctor is basically directing her, yeah, but not directive counseling. He's directing her because he has a vacation coming and he does want to do the surgery and I don't know, for money or whatever. So it's not C. Justice, no. Preventive ethics, veracity, also no. Okay, so B is right, is the correct answer, conflict of interest, and we said that because guys, the patient has a protracted active phase of labor. That's fine. It's kind of late a little bit, but it's absolutely normal, okay? And the patient also has normal signs. She has a category 1 fetal heart rate tracing and an available on-call obstetrician capable of managing her labor very, very easily and delivery, okay? So there is nothing to be scared about here. Therefore, the most appropriate management is continued labor for a possible vaginal delivery, even if the initial physician cannot attend. And actually, I'm reading the explanation. I've answered the question and I'm reading the explanation now, okay? So he doesn't have anything to worry about. So conflict of interest occurs when the process of informed consent is influenced or biased by a provider's self-interest. Providers are obligated to inform patients of all medically reasonable alternatives and provide care that is most likely to yield the greatest benefit to patient. Okay, on to the next question. A 30-year-old woman gravida 1 para 0 at 26 weeks gestation. 26 is about 6 months, over 6 months. Comes to the office for a routine prenatal visit. She has had no contractions, vaginal bleeding, or leakage of fluid. Fetal movement is normal. The patient has no chronic medical conditions and her only medications are prenatal vitamin and iron supplement. Pre-pregnancy BMI was 18 kilograms per meter square. She has gained less than the recommended 0.5 per week. Oh yeah. Vital signs are normal. Fetal heart rate is 150 per minute. Fundal height is 24 centimeter. Ultrasound reveals a fetus measuring in the 25th percentile for the gestational age. This patient is at increased risk of which of the following pregnancy-related complications? Okay, so let's talk about this. Okay, so the problem here in this woman is that she is underweight. She's actually less than 18, less than 18.5. Her BMI is very, very low, and this is dangerous, okay? Why is it dangerous? The pre-pregnancy weight shouldn't be as low, but if it's low, okay, no problem. We can manage that by increasing the weight gain over the pregnancy because the baby needs to eat, right? Here, she was very low, she had very low BMI, and also she gained less than the recommended amount of weight gain that she's supposed to get. So what kind of risk factor is this? Risk factor for what? So this is the question. What do we expect in a woman with a low BMI and very low weight gain over the pregnancy? Let's eliminate answer choices. Cesarean delivery. Okay, this is the actual opposite. Cesarean delivery is actually recommended for women that have a very high BMI, like obesity. Obese women are recommended to have cesarean delivery. Also, obese girls or obese women have high risk of gestational diabetes mellitus and fetal macrosomia, or the large head of the fetus, which also require cesarean delivery. And also fetuses with macrosomia are at higher risk for shoulder dystocia. Let's see the next question, fetal anemia. So fetal anemia isn't like regular anemia. So if you saw fetal anemia, it's possible that the most likely suspect here is hemolysis, the damage to the RBCs, which can be because of parvo B virus 19, parvo B19, or placenta previa. Placenta previa numbers, so B and A are not risk factors, so low BMI is not risk factor for cesarean delivery or fetal anemia. Number C, placenta previa. No, placenta previa risk factors are things like multiple gestation. The woman that has a lot of gestation. The way I memorize it is this: the placenta likes to change its location from one pregnancy to another. So if a woman has multiple gestation, it's likely that the placenta likes to change position from the normal to previa. That's how I memorize that. And also cesarean scar is also a risk factor for placental abruption. Preeclampsia? No, preeclampsia risk factors are like hypertension, family history, the race, the African Americans, things like that, but not low BMI. Preterm delivery, yeah, that's it. Preterm delivery because the baby did not grow as much, so it's delivered before time. And also growth restriction or low term or low weight birth, or low birth weight is another pregnancy-related complication to this woman because of low BMI. So during pregnancy, the infants have increased requirements. So the mothers have to eat more calories and more proteins and more macros in order to meet these requirements of these babies. And in the situations where this does not happen, this can put the infant at a very dangerous point, or this can put the baby at a very dangerous position in which he or she in which it cannot grow enough and would be subjected to preterm labor or low birth weight. Okay guys, this is the end of the video. We've killed 3 questions with 1 stone today. Hope you like the video, and please like and subscribe if you like the content, and stay tuned for more. Bye.